Hello guys, today we are going to learn about anticholinergic agents. These are also known as antimuscarinic agents. So here there is a content layout with list. First of all, we are going to learn about indication for this drug class. Secondly, we are going to compare and contrast rationally for use of drug class for different diseases and populations. Third, nurse role in evaluating the action and response of the drug class. Okay, so now we are going to learn about what anticholinergic drugs are. Anticholinergic drugs are class of medications which inhibit the action of neurotransmitter acetylcholine in the nervous system. For example, atropine. Acetylcholine mainly involved in the various body functions including muscle contractions, regulation of heart rate, transmission of nerve signals, etc. And when anticholinergic drugs block that acetylcholine, then they inhibit the parasympathetic nerve system's effects, which can lead to various responses. For example, including increased heart rate, dilated pupils, reduced salivation, relaxation of smooth muscles in the airway and gastrointestinal tract. Acetylcholine is responsible for it is a neurotransmitter of parasympathetic nervous system. So anticholinergics are given to oppose the effect of parasympathetic nervous system. So here we so now we are going to understand what are the indications for anticholinergics, like in which conditions healthcare providers prescribe these drugs to the patients. First of all, let's talk about the gastrointestinal disorders. In irritable bowel syndrome, it helps to relieve the symptoms like abdominal cramping and diarrhea. Because how it do that? Because it always relaxes and smooths the muscle contractions, and that's why it helps in irritable bowel syndrome. And secondly, peptic ulcers, it all reduces the gastric acid secretions and also decrease the acid related symptoms. So this is how it helps to relieve peptic ulcers. Second conditions are respiratory conditions. In respiratory conditions, in asthma, ipratropium is very widely used anticholinergic, which helps to relax the airway muscles and improve the airflow in the patients with asthma. And secondly, in the chronic obstructive pulmonary disease, it also helps to manage the bronchospasms, and it helps to dilate the bronchioles and helps to exchange of air very smoothly and helps to relieve the symptoms in the patient. The next disorders in which healthcare providers prescribe the anticholinergics are neurological disorders. In neurological disorders, mainly in Parkinson's disease, it helps to alleviate the symptoms like tremors and rigidity, as we already know, because it helps to smooth the muscle contractions. Next, tardive dyskinesia. In some cases, anticholinergic drugs helps to change inflammatory movements, as these are the side effect of antipsychotic medications, we can say. So we also prescribe these medications in these conditions. And in ophthalmic conditions, whenever there are dilated pupils and conjunctivitis, then these drugs are prescribed. Urinary continence, there are drugs like oxybutynin and tolterodine, which are help to treat the overactive bladder and helps to reduce the inflammatory bladder contractions, which automatically helps to control the urinary incontinence. The scopolamine is the very widely used anticholinergic, which helps in the motion sickness, helps to prevent the motion sickness. There are some other conditions like where anticholinergics are prescribed in psychiatric disorders, also like in schizophrenia and anxiety, just to ease the mind of the patient, and in preoperative medications also, and in poisoning and overdose treatment also anticholinergic drugs are prescribed. Okay, so now we are going to learn about the compare and contrast rationally for use of drug class for different diseases and populations. First of all, let's talk about in respiratory conditions like in asthma and COPD. The goal of anticholinergic is to improve the airway function. So we use these anticholinergic drugs both in pediatric and adult populations. as there will be a differences in the dosages and the prescribing amounts, but we can prescribe these to both pediatric and adult populations. Secondly, in gastrointestinal disorders, these drugs aim to alleviate symptoms but may be short term. So, they are typically administered to adults, and these are not administered to the young children, as there are more risk of toxicity and adverse effects in the young children because of the physiological differences between adults and children. Next, in neurological and psychiatric disorders, the anticholinergic drugs are used to manage specific side effects of other medications. So they're usually used in adult populations. So here we also gonna say that we are not going to use the um, anticholinergic drugs for neurological and psychiatric disorders in the young children. So there will be a more risk of toxicity in them. And next is ophthalmic applications. Urinary incontinence and motion sickness involve a broader range of populations and age groups. It depends upon the in to which problem doctor is prescribing the anticholinergic medication. So now we are going to discuss the nurse role in administration and evaluation of anticholinergic drugs. First of all, patient assessment. Medical history, allergies, current medications, that all things nurse have to assess before administering this medication, because assessment is a crucial part of the nurse's job. Second, education. The purpose of the medication, potential side effects, importance of compliance to the drug. These all educationers have to provide to the patient and also the patient's family, so they can know everything about the drug. Third, monitoring. Nurses monitor patients for any adverse effects such as dry mouth, constipation, blurred vision, or changes in vital signs. These all are the side effects of anticholinergic drugs. So nurse have to time to time nurse have to monitor for this adverse effect in patients, and also have to tell the patient about the side effects or adverse effects if they are gonna notice these side effects in themselves. So they have to report these effects to the nurse. Also, the collaboration, nurses have to work closely with other healthcare professionals to evaluate the patient response to the medication. So, if nurse notices any kind of adverse effect or any side effects in the patient, she have to tell to the doctor about that, so that doctor can also initiate their assessment. And also, documentation of the drug is very important so that we can keep a track of the medication.